The fatigue that comes with heart failure is unlike any tiredness you've felt before. And I want to say clearly right at the start, it's not laziness. It's not you getting older. It's not you trying not hard enough. You've probably tried to explain it to people, maybe to family, maybe to friends, maybe even to yourself. And the words never quite land because this isn't the tiredness that a good night's sleep fixes. It's deeper than that. It's different. If you've ever wondered whether your feeling is really as significant as it feels, it is. And there's a real physiological reason for it. I'm Dr. Jodie Ann, Senior, a cardiologist and heart failure specialist. By the end of this video, you'll understand exactly why heart failure causes this particular kind of exhaustion, the different factors that contribute to it, what's worth raising with your care team, and one practical shift that genuinely helps. Here's something that happens far too often, and it matters. Patients describe this fatigue to the people around them, and it gets minimized. Everyone's tired. You just need more sleep. You're not that old. And sometimes patients start to believe that themselves, wondering if they're exaggerating or being weak or not pushing through the way they should. And honestly, everyone around you probably says they're tired for one reason or another. So you probably think this is normal anyway. That minimization does real damage to self-trust as well as trust in our relationships with others. Because this fatigue isn't a mood or a mindset problem. It's a distinct physiological cause. Actually, several working together. And understanding them changes how you relate to what you're feeling. Let's talk about why this happens. Think about a car with an engine that's lost some of its power, and it can still run. It can still get you where you need to go. But every system that depends on that engine, the air conditioning, the power steering, the electronics, all of them get a smaller share of the power available. Even sitting at idle, the whole car is working with less. Your heart is that engine. In heart failure, it's pumping less blood with each beat than it used to. That means every organ, every muscle, every tissue in your body is receiving a little less oxygen, a little less nutrient-rich blood than it needs. And even when you're doing nothing at all, even at rest. That's a fundamentally different kind of tired to being a bit sleep deprived. Sleep deprivation tiredness resolves with rest. This fatigue is happening at a cellular level throughout your entire body all the time because the fuel delivery system itself is running a bit under capacity. But reduced cardiac output isn't the only factor. There are several others working alongside it, and it's worth understanding all of them. Your medications can contribute to that sense of fatigue, particularly beta blockers, especially in the early weeks of starting them or after a dose increase. This usually settles over time, but it is real and it's worth knowing that it's a possible contributor rather than assuming it's purely the disease. Poor sleep quality plays a significant role too, even if the number of hours looks adequate on paper. Needing to lie propped up to breathe comfortably, needing to get up multiple times overnight because of your diuretic and having to go to the toilet, and the simple anxiety that so often accompanies a heart failure diagnosis all fragment your sleep. So the quality is far lower than the hours would suggest. Deconditioning matters as well. If activity was reduced over time, which is common and understandable, your muscles lose fitness and strength, and that itself worsens fatigue, somewhat independently of what's happening in your heart. And this is where exercise can be so beneficial. Anemia and iron deficiency is also common in heart failure and frequently under-recognized. A lower red blood cell count means less oxygen delivered throughout your body, compounding everything else. And there's good studies validating iron transfusions when there's iron deficiency in heart failure. And then there's the emotional weight of the diagnosis itself. Living with heart failure carries real psychological load, fear, anxiety, and depression, which is more common in heart failure than many people realize, and is deeply fatiguing in its own right, separate entirely from the physical processes. Most patients are dealing with some combination of these factors, not just one, which is exactly why fatigue feels so total, so overwhelming, and so hard to shift with a nap or an early night, or a bit more rest. So, what's worth raising with your care team? A few specific things are worth a mention explicitly because they can genuinely be improved. If your fatigue has worsened suddenly or significantly, that's worth flagging. It may signal that your heart failure needs a new medication review, or maybe you need iron or blood. And it fits into the same 4 zones framework that we use for weight and symptoms. So if you've never had your iron levels or a full blood count checked since your diagnosis, ask about it. Anemia is treatable, so is iron deficiency, and treating it can measurably improve your fatigue. If your sleep is fragmented by needing to lie propped up, or you're up multiple times overnight, mention that specifically. There may be adjustments that might help. And if you suspect that your feeling includes depression alongside the physical fatigue, please say so. This is common, it's nothing to be ashamed of, and it's genuinely manageable with the right support. Here's the one practical shift I want you to try. Most people respond to fatigue in one of 2 ways. They either try push through, forcing themselves to do everything at full effort, regardless of how depleted they feel, or they give up on activity altogether, cancelling and withdrawing. Neither of those genuinely helps. What actually helps is pacing. Today, I want you to choose one single thing you'd normally do and do it at roughly 70% of your usual effort. Not 0, not 100, not 130, 70. Slower, with a rest built in part way through if you need it. Giving yourself permission to stop before you've completely been spent rather than after. This single shift, pacing instead of pushing, is one of the most protective things that you can do for your energy over time. Don't just push through and don't just give up. It sounds small, it genuinely isn't. So let's bring this all together. The exhaustion you're feeling with heart failure is real. It has genuine physiological causes: reduced cardiac output, medication effects, fragmented sleep, deconditioning, anemia, and sometimes depression, often several factors together. It's not laziness, and it is not simply you getting older. Understanding why it's happening means you can respond to it more appropriately, raising the right things with your care team and giving yourself permission to pace rather than push through or withdraw entirely. My free heart failure tracking kit includes the talk test method, which doubles beautifully as a pacing tool for exactly this. It helps you gauge what you've genuinely got in the tank on any given day. It's linked in the description below. Subscribe for a new video every week because I'll be here, and this is all designed to give you the clarity that maybe your appointment didn't have time to.